All right, let's stay with the football theme because it's time for another Blitz medical moment.
Yeah, we've been doing sports medicine themes the past few weeks, and right now no sports medicine topic is getting more attention than this one. They are a hot topic these days, and deservedly so, but just because concussions are getting more attention doesn't mean they're a new occurrence.
Back then, people would say, oh, I just got my bell rung, I just got a ding. Well, being a ding or having your bell rung, that's a concussion in anybody's book that knows anything about concussions.
We see them in contact sports, football, hockey, boxing, but you might not suspect a sport that has an exceptionally high rate these days.
Girls soccer is the second highest rated number of concussions in sport, and so we're seeing a ton of females who are coming in with concussions playing soccer.
Basically, any sport that involves the head can be a threat. If a helmet's required, you have to make sure it fits properly and wear a mouth guard to keep your teeth from crashing together. But it's not just equipment. Many schools and teams are now doing what's called a baseline test before the season starts.
And you take a look at that score. After they get a concussion, you retest them and see how they compare to the baseline test that they took. What this is basically looking at cognition, how the brain is functioning, how they're processing. So it takes a look at visual issues, verbal issues, as well as reaction time.
If you suspect an injury may have occurred but aren't 100%, there are a few things you can do before deciding to send them back in the game or head to the doctor.
So the first thing you want to look for if somebody gets hit is see how they're acting. They may kind of stand up after they get hit and just kind of be woozy and kind of wobble around. You can ask them the date, you ask them what the score is of the game, you ask them what the scores was last game, what team they were playing before. Do some recall, give them some things to remember 5 minutes later, ask them those things over again. It tests sensation, test strength to make sure there's no injury to the spinal cord at all.
When in doubt, sit it out. It is the brain we're talking about, and even with all the research, we still don't know exactly what effects a concussion has long term.
There's a ton of research into that right now, whether there is an association with concussions, with brain injury, brain damage for the long term. So that's something that continues to evolve over time right now with the research that they're doing on these players.
Dr. Axtman says kids and teenagers are most susceptible to a concussion because their brain is changing so rapidly, and though we often call them season-ending, 40% of concussions, he says, heal in a week, 80% heal in 3 weeks.